right, looks like it's 2, so I'm going to respect everybody's time and plow ahead. So I was asked to present an overview of how to write a research question. No one asked me to. Deb, I don't think you're muted. Or at least I hear somebody in the background there. Anyway, how to write a research question from a reflective approach is one that I chose to take because I feel like we come up with a lot of great ideas. We're clinicians, we see, boy, why doesn't this work? What's the problem with this? Why aren't people actually following through on things? We have these professional guidelines and recommendations, but when push comes to shove, we just do what we do. Our schedules are tight. We have to see a certain number of patients. We want the clinic we work in has certain protocol. In an educational setting, we have assignments to complete or competencies, things that just direct what we are able to get done in any clinical setting. Yet on the other hand, we look at things and wonder, how can we do this better? How to improve this? So for our learning outcomes, because it's a reflective approach, the idea of thinking about the research question or what we want to learn, what we want to do, how to change things up, how can we do this better? If I try this out, will people adopt it more? And again, this presentation is not so much, it is not really for the experienced researcher, although it kind of gives them a sense of how valuable mentoring is to folks who are just starting out. But this is really the idea of taking the time, taking the opportunity to really think through what you want to do, what are you really interested in, what kind of lights your fire as far as passion of really sticking with the topic and following it through, because doing a research project is not for the faint of heart. It takes a fair amount of time, it takes a lot of effort, and especially when we have clinical obligations, it's a time commitment. And so thinking it through and looking at all the ins and outs and kind of like a Rubik's Cube, turning around and turning it around to get the right sequence and the right components will save you a lot of time in the long run. And then there's an enormous amount of value, appreciating the value of looking into the literature before you move forward with any kind of research project. And we'll talk a lot more about that. And then to employ something called a mind map. Some people like these things, some people find them terribly annoying, but I think they're valuable because it helps sort out a plethora of information once you dig into the literature. And then where do you locate the literature? This isn't really going to be an overview of how to dig into the literature and do a quality literature search. A lot of resources on that, but I'll touch on it. And then employing the PICO research model to develop your research question. By the end of this, I'm hoping that you'll have a sense of how to plug in the different components of the PICO model, and then how that helps you develop the research question. And then the value of creating that research question, because it's going to be the center piece of your research project. So we're all, I think, fairly cognizant of the need and the value of employing evidence-based medicine or evidence-based dentistry information. I know the American Dental Association has a whole unit committed to the idea of EBD to look at what the literature says, pull out what is important to clinical practice, and let that help you inform what you buy for your clinical practice, what materials you use, how you approach dental care. Of course, evidence-based dentistry also wants to know what the patient prefers, and then it bases it also on the clinical experience of the clinician. So there's those three components of EBD, or evidence-based medicine. But taking kind of that step back, how did that peer-reviewed journal get that information? How did that researcher come up with that question? How did they decide to actually research that? And why did they choose that topic? And how, when you launch into the process, how can you learn from what others have done that is the foundation for the EBD journal articles? Of course, we're answering questions. How many do we need to use or employ? How often do we need to utilize a certain maybe tool or skill set or intervention or training tool? How much of it do we need to employ? So you're asking, you got a kind of an idea, but then you kind of tease it out of how many, how often, how much, why does this happen or not happen, and what would happen if we tried this. So I think you're seeing that I'm not so much focusing in for this time that we have together on, say, something involving bench science or basic science. This is really focused in on clinical research. That's what I do in my position as a research director at the Missouri School of Dentistry and Oral Health, both in St. Louis and in Kirksville. All of our faculty are clinicians, clinical dentists, and a few dental hygienists. And they have a great deal of time on the floor or in the lab working with students. So some of our faculty have an extensive amount of experience in research, and some have a lot of experience in basic science research. But many of our clinicians come to faculty, come as a faculty member right out of clinical practice. So they may have done some small research project for the master's degree 20, 25 years ago, but now they really, they may not really have that foundational information. So my job actually is to support faculty in their gaining of the skill set to be able to conduct research activity, clinical research activity, both educational research and clinical research. So what are some possible clinical questions? The sky's the limit, truly. There is so much out there that we can explore and look at and take apart and dig into. The key thing about a possible clinical question is that an enormous amount of work has already been done. And the value of coming to development of a clinical question using a reflective mindset or framework is that you take the time needed to think through what has already been discovered and what has moved the topic forward. The thing is to get published with a research project and to disseminate your information from your research project, it has to provide new information. So it may be really interesting to you, but it may have already been studied, established, and a part of a guideline that to go then back into it and redo it will not, in all likelihood, be viewed as something publishable because it's already known. Thinking through a research question, you want to think in terms of what is it that's already been done and what is unknown. And I think all of us, as we work with patients and interact with students, many things come up like, well, yeah, I don't know. I'll have to look into it. Um, but a mistake you want to avoid is that because you may not have complete knowledge on that topic, that somehow that's a good thing to then go do a research study on and start going through that process. Um, Thinking up questions is really important, but the next several steps will help you a great deal in narrowing down what to actually move forward with. So what I'd like for you to do now is take out a piece of paper, and I'd like to just take a few seconds to have you write down a topic or a question that you're interested in. First, for whatever reason, you came to this program, and when you're on the clinic floor or you're interacting with your students or you're preparing your lessons, what are some things that you wonder about as far as maybe educational methods, or are apps valuable in working with students to help reinforce concepts for patients? What would help them best comply with their medication regime? What's interesting to you? So write that down if you would. For the sake of this program, I'm going to choose the topic of smoking cessation in a clinical setting. Now, I chose this one because I'm afraid I've spent the past 25 years researching only that. Although I've kind of added in cannabis use and e-cigarettes and a few other things. But the vast majority of my research career has been focused around tobacco treatment education. So I thought, you know, smoking and smoking cessation and the effects of smoking is applicable to all healthcare settings. So that's why I chose it, and we'll be using that as an example. I'm very passionate about it. That's another thing about choosing a research topic and a research question, is that it should be something that you're really interested in, because it takes so much time and so much effort and so much thought to work on a particular topic, that if you're not really interested or not that passionate about it, you're going to get bored and you're going to just not follow through on it. That's a common mistake, is that people say, oh, that's interesting, but then they're 10 hours into it and it's like, well, I'm done with this. But they haven't really finished out the project. So tobacco cessation is important to me, just because both my parents were heavy smokers, and my brother used smokeless tobacco and also smoked. And they all died at a very early age, stroke and cancer, and a variety of different chronic diseases. So it was valuable and exciting to me to be able to study this topic and continue to do so. So you have an idea, you've written down an idea, you've thought about what you'd like to look into, to explore. I'm a big fan of saying there are many ways to do exactly the same thing. And I'm going to go ahead and go with the PICO research question model. There are others out there. Some don't use PICO at all. Others, that's all they use. That's their model, and that's what they're comfortable with. For the sake of keeping this practical and functional, I'm just going to go with the PICO model. And what it stands for is patient, problem, population. I would be intervention, C, comparison, O is outcome. So what I'd like for you to do now with your research topic on that piece of paper is to write the mnemonic PICO, and with your topic, just kind of fill in who would be your population, or what would be your problem, or who would be the patient. Would it be adults 30 to 35 who have diabetes and don't check their blood sugar. Um, Try and break it down with that PICO model to just kind of start the process, thinking through the idea of take your idea and who do you want to study, or what is the problem? What would you like to do? Would you like to try a certain training module? Would you like to try a sequence of appointments? Would you like to try out a educational pamphlet, look at health literacy? The sky's the limit. There's a lot. I mean, it's just a way, a practical model to start teasing out a big concept and bringing it into some type of usable format so you can move forward. Also, one thing that the PICO model really does well is to identify keywords. So the big concept of tobacco cessation, well, I'm looking specifically at clinicians. Now that could be doctors, dentists, nurses, PAs, dietitians. It could be any healthcare person. But if you have a specific clinician in mind, then you would put that in. Intervention, what type of tobacco intervention? Are you really interested in pharmacotherapy? Are you interested in seeing if e-cigarettes make a difference in helping people quit? Are you interested in a training program, or again, a pamphlet? Or how can you increase the referrals to a quit line? So something that you would actually do, some intervention for your population. And then a comparison, a lot of people just either don't do it for a group and not do it for another group, do the training, offer the pamphlet, but whatever intervention you've identified, oftentimes the comparison would be not doing that. But in the case, say, of a survey, an assessment of what people think of something, there is no comparison. There are times when you'll just leave that blank because it doesn't fit. And then what would you like to see? What do you want to know? In this case, does providing provider training encourage the provider to actually offer a tobacco cessation intervention? But this PICO question, or this process, does not narrow down or automatically pop out a research question. All these concepts are very vague. So the process we're going to go through is taking a big concept. If you can think of a funnel, take a big concept and narrow it down and narrow it down and narrow it down to where, when we finish with that research question, it's going to be laser clear who, what, and what you expect to, or what you want, what question you want answered. So the keywords would be smoking cessation training. Personally, I like using the terms tobacco dependence treatment, but if you put those search words in, you're not going to get as much information. And as far as how to really narrow down and get some good search words, I would strongly encourage you to work with the ATSC librarians. Susan Swager's one, who really is very, very helpful in literature search, and the Boolean system. And I'm not going over that, but key search words will help you narrow down what you need to do and get to the information that you need. And in a little bit, I'll show you too broad of search words are going to get you way more information, and then you have to kind of wade through it. But there's a way to avoid that. And then, so here we have the PICO, and so a general clinical question is, why don't clinicians provide smoking cessation consistently, and will training help? This is not a good research question. It is a preliminary research question. Anybody want to jump in and take a stab as to why this is not a very good research question yet? It's just preliminary. Hearing none, I'll continue on. So far with your piece of paper, you have your general idea. Hopefully you have your PICO written out and some general thoughts on what the different components you want to look at. And then it may be good to go ahead and take a bit of time and create kind of a general research question. What is it that you want to know based on your PICO and how you kind of sorted it out? So it's a process. It's again, thinking things through, but really we're at the very, very front end of things. So this is probably the essence of this reflective concept, is actively seeking existing knowledge. So I work with a lot of faculty and a lot of students who they're really excited about an idea. They're just so passionate about it, like, oh, this is what I want to do. And they come up with the idea. They come up with oftentimes a general question with big words like clinician. Well, what clinician? Is it a doctor? Is it a dentist? In what setting? Is it a community health center? Is it in a hospital? But there oftentimes those initial questions and PICO statements are fairly vague. But then they just kind of want to sit down and do the project. They want to sit down and say, okay, we want to give this to this person and test this and try this out. And they're all ready to jump out and do the project. And you can understand why, because you're excited about wanting to know the answer. However, I can't overstate the value of going out and taking the time to find the existing knowledge. So how do we do that? Research mentors, maybe senior faculty, maybe individuals who you know from another university, who may be interested in the topic, or they're interested in medical education, dental education. There are many, many individuals out there who have gone through the same process. You're just starting out or in the middle. And oftentimes they're very gracious in taking the time to hear what you're wanting to do and then give you very strategic and focused feedback. Now that feedback can save you a lot of time, a lot of aggravation, and a lot of frustration, because they will have a sense of what would be a good way to go through the process, or they already know that this topic has been researched and in clinical guidelines, but maybe this would be the way to go about it, or this would be a better angle. To me, research is not an individual sport. It's a collective team effort. And finding the right people to bring in the right piece of information, when to bring in the biostatistician, when to bring in the individual who has done a great deal of survey work, or whatever the specific things you need for your project once you get past the research question. To be able to tap into a good mentor or a group of collaborators will help your process and your work exponentially. And so taking the time to find those would be very helpful. So just a little bit about my journey, which might help put context into the value of this. I was a faculty member at Southern Illinois University in Carbondale, Illinois. And the CDC dropped $1 million grant into our lab to create a tobacco treatment campus, or a tobacco-free campus. At that time, Illinois was not tobacco-free. And my part to play was to create a tobacco treatment curriculum. And I didn't know anything about the topic. I knew my parents smoked and that it was harmful, but I really hadn't looked into it. And so I didn't know any tobacco researchers. It was still a relatively new topic to me. So my process was that I went to the journals and found out who was actually currently publishing in the journals about tobacco treatment and dentistry. And the wallflower that I'm not, I went ahead and got their name and called them up, and I said, can I come and visit? Back in those dark ages, we didn't have Zoom, we did have phones, but and these were full professors. They were gracious enough to say, sure, come on over. So I went over to Indiana, where a tobacco treatment specialist was there and gave me a great deal of information and insight on what was important and directions to go in. And then another faculty member up in Winnipeg was down visiting in Chicago, and I went and visited her. She did exactly the same thing, which kind of set the stage for me that as I moved through my career in academia, I became very committed to mentoring and supporting junior faculty in their journeys as well, because so many full professors did that for me. So finding that mentor, finding that person who at least will look at your project and give you some feedback, even if it's not in your field, they'll know the process, will be very, very helpful to you. And actually, you become lifelong friends. You might end up doing research together, writing articles together. But it's a very enriching process to have a good research mentor. Explore feasibility. They'll let you, as you discuss this with your mentor or someone just to talk to about it, do you have enough time to do it? If you have a very busy clinical schedule or you have a lot of obligations and you're looking at this very large project, you may need to, as you're trying to figure out your research question, do you have enough time to do A, B, C, D, E, F, G? Maybe you just have enough time to focus in on A, B, C. Do you have access to the records, the people, the resources? An experienced researcher will be able to help you sort through the resources that are needed to, and the capacity to do a project. Again, you may have a great idea, but it's so big and just too much to really actually get done in the time that you have. And then this is probably the center stone of the steps of doing this, besides reflection and discussion, is to conduct an initial and then later on more extensive literature review. Very few early researchers go into the literature to find out what's already been done. Now, I know I've mentioned that, but I can't stress it enough. Using the PICO terms, going into the literature and seeing what's already been done, what is already known, what's not known, what has not been discovered. How can your project actually develop and formulate new knowledge? And then you can kind of get an idea of maybe the hundreds, thousands, and even hundreds of thousands of articles that have already been written and published on the topic. Your idea may be phenomenal, really important, really interesting. But then when you go into the literature, you find that there are 80 articles that have looked at exactly that. And then a meta-analysis has been done on that question. And then that information has then been moved into a practice guideline. So even though it's a great idea and very important, without going into the literature and finding what's been done, you're going to end up with a project that if you're needing to go ahead and publish that and get that out there, it will have already been done and it won't be accepted for publication. Also, you can find out by looking at the literature, how did other people do that project? What was, going back to the PICO, what was their population? Did they look at only, were all the studies only looking at youth 18 and under? Were all the studies looking at adults 65 and older? Well, maybe you have the opportunity then to look at a younger population, older population, looking at health disparities of that population. So it's not that you can't do your topic. It's that you find out the constellation of things that have already been identified and looked at, and maybe looked at many, many times. You won't know that unless you actually go into the literature and look at it carefully. So I have a lot of expressions, and one of them is watch out for the rabbits, don't chase the rabbits. And so what do I mean by rabbits? I'm going to back up a bit. As far as looking at the literature, AT still has an excellent library resource in their librarians and their websites. Because I'm with Mojo, I refer students and faculty to the resources that the libraries put together for our school. And I'm sure, and I know they have for all the different schools. So the value of directing students and you as a faculty member going in and taking a look at what's available on the library site will save you, again, a lot of time and frustration. They also have how do you do a library search, tutorials on how to do utilize PubMed. So a lot of these are just skill sets that there are already videos, there are already printed material, there's how-to steps, and then the librarians, if you contact them, they're amazing about getting back to you. So being a researcher involves tapping into the resources, connecting with the appropriate people, and because we all have limited time, and utilize what's out there. And AT still has a lot of great resources. So just before, as I was creating this presentation, tobacco treatment is a very highly researched topic. And if we look at how many I typed in those PICO terms, smoking cessation, physician, I got 210,000 hits. So just a pointer, usually I have faculty or students just look at the past 5 years of research on the topic. But in the case of tobacco treatment, a lot of good information has been collected and analyzed prior to that. So I may extend that to 10 years or even 15 years for the range. But you need to be able to narrow it down. But again, I'm not focusing in on how to do an effective literature search. But let's just take a look at this. We have physician advice for smoking cessation. So Cochrane database, I'm sure you've heard of that, but they do an extensive, very highly detailed meta-analysis of existing literature in a certain time frame with certain search terms, and then provides a summary of what the best practices are. So part of your literature search and looking into your general concept of what question you'd like to answer, you always want to try and search out any Cochrane reviews on the topic. And Cochrane happens to have a lot of reviews on tobacco treatment from a variety of different angles. Also, because I said physician, here's physician advice for smoking cessation. And it's another, it's actually similar one. Here's an older one, here's a newer one. And then here we have an 88 study. So again, limiting the search time frame can be very helpful. But randomized trial of family physician interventions, all to say that even just a cursory look at the literature, we're going to find that there's an enormous amount of research on what physicians or dentists are doing, clinicians are doing for tobacco treatment, how they're doing it, why they're not doing it, what strategies have been used, what programs they've used, have they looking down at related searches, views and practices, interventions, nicotine patch therapy. So what would the intervention look like with different kinds of medications? What kind of advice is offered? And then for randomized controlled trials, double-blind trial, I think more for clinical research, we may not be doing that so much, but certainly those are options. And then the behavioral approach or counseling. So tobacco intervention can just be, I see you smoke, you need to quit. as opposed to a behavioral intervention where you really talk a lot more about well, what's going on with you. Um, Tell me what kind of things have you done so far to try and avoid smoking. Um, there are a variety of different strategies you can use, but this just gives you an idea of what I call rabbits. So if you're interested in tobacco cessation training for physicians, then you're going to want to avoid things about nicotine patch um, and um, and kind of focus in on counseling or maybe tobacco education modules. Again, it all depends what you type in here. But it's very easy on a very complex topic like tobacco cessation to be overwhelmed. And one way to avoid being overwhelmed is to stick to your PICO information and continue to narrow down your research question. So another strategy to do that is to create a concept map. A concept map, let's take a look at this upper right-hand corner. You have the main topic, and then you have an idea, and then a related topic, and then that feeds into that. So if we have tobacco cessation, we could look at medications, and we could look at a specific medication like varenicline. Or we could look at motivational interviewing and behavioral approach. Or we could look at apps. Do apps help people quit smoking? We could look at physicians using the quit line to support a tobacco cessation intervention. So the more you know, the more you dig, the more options or rabbits are out there to chase. But then you just kind of have to decide. And again, talking with a colleague about this can really help you clarify what's important. What are you going to focus on? So here we have a broad question. Why don't clinicians provide smoking cessation beyond asking? Then you do an initial literature search, like, well, okay, what's out there? We looked at that Google search, kind of general. And when we actually looked at the literature, we found that common themes of clinicians said they didn't provide a comprehensive tobacco intervention. They didn't have enough time. They didn't have enough reimbursement or insurance didn't cover it. They didn't have enough training. They didn't see it their job. So I'd say there's probably easily 5,000 articles or more that basically reflect these four concepts. There's a lot out there, not only in the US, but internationally, because it's a conundrum. What, the Surgeon General's report came out in 1964, but yet we still have 34 million people smoking. It's less, but they're still smoking. But as you peel that onion, so to speak, and look at why clinicians aren't providing it, these are the stated reasons. But then if this is what you're interested in your clinical setting, what makes sense to you? What is it that, what doesn't make sense to you? I mean, why aren't people doing it? What are you seeing that really identifies what needs to, what you're not sure, what you really don't understand? So if you're interested in the idea of, well, you know, our physicians haven't gotten any training on tobacco treatment, I bet that's the reason why they're not actually doing it beyond just asking. So you looking at this mind mapping, you can plug all these in and put it out here if you like the visual approach or the more linear approach. But you've decided lack of training. That's why they're not really providing interventions. So then actually you have to go back to the literature and do a more detailed search. So now in the search engine, you're going to put smoking cessation physician training. And you're going to come up with a lot more information of what kind of training is out there, how long, who provided it, what was the content, what did they focus on. And this is another good time to talk about the process. So you actually come up then with a more focused project. Will smoking cessation training increase tobacco cessation counseling? So we're narrowing it down a little bit more, and you consider, you reflect, you explore, and again, by going through this process, and it may only take a couple weeks or a month to do this, but I'm kind of breaking it down into a small format of, or step-by-step format of putting that reflection and brain power up front, and it'll save you a lot of time and effort in the end. So one rabbit you could chase, or would targeting youth and training programs on tobacco cessation for youth. That's kind of a very specific population or group that you'd focus in on. Why is cessation important? To let the physician know the level of harm and why people smoke. It's because the nicotine addiction. So then would you focus in on medication support? What about e-cigarettes? Is that something in your training you feel like that would be an important thing to bring out to the physician, as far as should we be recommending e-cigarettes or not? Should we focus in on the systemic or general health issues that it causes? Again, to motivate the clinician to provide more interaction and connect with the patient more about this. So again, these are kind of a part of that concept map of what aspect of the training are you going to focus in on, because there are many out there. Are you going to look at health equity issues? So it's not a matter of doing a half-hour, 45-minute training program. What do you want to focus in on, given the needs and the questions you have, or the interest you have in your clinical setting? What chairside program might you adopt or adapt? And if so, what would you want to, how often would you want to train? What part of the information would you like to zero in on? A lot of choices. And again, talking with a mentor and reflecting can really help this process. We look at a behavioral approach where you focus in on motivational intervention and how to do reflective listening and empower the person and understand them, and come at it from a facilitator approach, as opposed to you smoke, you're having asthma, if you quit, this will be a lot better, and then move on to the actual reason why they came in. This takes a lot more time. Okay, so now we've got a barrier of time in your training. Maybe that's the barrier as to why they don't do it, because they don't feel they have enough time. Can you create a training program that will actually empower a clinician to overcome that barrier? So then you refine your concept map. Again, more reflection, discussion, and gather more information as you need it. So here we have a broad question. Did an initial literature search. Found that these were at least some of the key topics as to why clinicians do not consistently provide tobacco treatment. You decided to take the lack of training because that was something that you're interested in. You went back to the literature and looked at training programs, tobacco cessation for physicians, say in community health centers. Then you create a more focused question. Will smoking cessation increase tobacco cessation counseling? So it's still too broad. Cessation training, it's not clear enough. Counseling, what will that encompass? And then you can reflect and consider some more. And then, so here might be a focused research question. Will providing primary care physicians a 45-minute interactive tobacco treatment training using behavioral approach increase minutes spent on tobacco cessation intervention with adults? So if we back this up and put this into a PICO, it would be a lot more specific, it would be clear, and by having a very focused, clear question, you will find it a lot easier to create your protocol. So now you know who your population is going to be: primary care physicians who work with adults. Your intervention will be a 45-minute interactive tobacco training program using a behavioral approach. So now you know the what. The comparison would be, say, another group of physicians who did not receive this training. And then minutes spent will be how we will define or evaluate whether the program has worked by looking at the number of minutes or number of tobacco interventions that they provided over, say, a 6 months to 1 year period following the training using the electronic health records. So you would probably never, ever get to this research question unless you went through that process. And again, it sounds like a little labor intensive, but this getting to this very clear question, that you know that it's new information, you know that it's important, you'll know that you'll have time to do it. It defines your whole research project, because the next step would be actually creating your research protocol based on this very, very focused question. So the purpose and value of a well-reasoned research question: stay focused, guides your complete research project, informs the development of your protocol. After you create that research question, you want to, of course, reach out to a biostatistician to discuss your project, and they'll be able to help you further refine your project and make sure that whatever data you end up with is actually answering the question. And also for the possibility of being able to publish this outcome, you have done all your background work to feel comfortable that an editor who receives this article will, you will have made the case that this is new information and moving the needle forward. These are just the key points: taking the time, initial search, concept map, locating credible, comprehensive resources, and to develop that question. Some excellent resources for you can be found at ATSU's research support. The research support has an amazing team of biostatisticians, technical writers, scientific writers, project specialists. They can help with surveys. They can help you refine your research question. You would actually go to the website, ATSTILL's portal, and ask for help. You fill out a form, and then that process will be started. So thinking in terms of a mentor for discussion, thinking in terms of research support for specific technical help, thinking of the library for assistance in doing that initial and in-depth literature search will really save you a great deal of time trying to figure out, well, how do I approach this and what do I do with it? There are a lot of resources the university's provided, both faculty and students, to be able to do clinical research. And one really good YouTube video that I found, I mean, there's a plethora of information out there, certainly articles and booklets and resources and PowerPoints, and you name it, it's out there, about developing a research question. But this one is, I thought, particularly good, presented by a faculty biostatistician, looking into the specific types of research and a research question, both descriptive, relationship, comparative, and causality. So the faculty actually goes through these different types of research methodologies, and then helps develop a research question based on these different types of research methods. So that is my presentation. I wanted to leave time for questions. It is a little bit different approach in developing a research question, but I hope you found it helpful. And there's my contact information if there's if you'd like to ever reach out, and I'd be happy to talk with you about even your research question or how to narrow it down. I personally have mentored many different faculty throughout the country and a couple different countries outside the US. I enjoy it, I love it, and it's fun to see people succeed because a lot of faculty, full professors, were gracious enough to do that for me. So I'm going to stop there. Does anybody have any questions or thoughts or comments?
That was great.
Dr. Davis. Oh, sorry.
I was going to say that was great, Joan. Thank you so much.
Oh, hi, Lindsay.
Hey.
Thank you.
Yes, for sure.
Appreciate it. Anybody else have any thoughts? Dr. Wright is someone who I've had the pleasure of working with.
Dr. Davis, this is me, Deb. I have one question. I knew that I thought that I knew how to write a research question. Apparently, there's so much information. Thank you for the presentation. I feel like this was a class we needed in grad school. So I have one question. So what I usually do does not require having a comparison. So the interventions I study, I look at the problems with the intervention. So if there are no alternatives to the intervention, how would that impact my question? Like, I guess it's something that I can think through, but is it always necessary to have an alternative to any intervention study?
Such a great question. No. No. If you are what I always recommend is to, again, I will always go back to the literature. And in the methodology of the topic and the population that you're looking at, say for tobacco interventions or training, you're going to see if they actually had an intervention or if they were just doing an exploratory study, or there are a variety of different types of studies. And at that point in time, you may want to ask the biostatistician to help you clarify what type of study that may best fit what you're wanting to look at, and narrow that down. You won't necessarily, you're going to have the group that you're going to be looking at, and you're going to be doing some type of activity, but it may not be an actual intervention, do this in this one group and not do it to the next. It may just be an assessment, such as a retrospective cross-sectional study. You're just going to go back and take a look at maybe some type of treatment or something occurred, and you're just going to follow what information actually comes forward. So you're kind of exploring potential relationships, but there's no intervention, right? I mean, you're not doing anything to them. You may just be looking at how many smokers are in a patient pool who have heart disease. So there's no truly intervention there. You're just looking at information, and then that's a component that would then build on your next phase of your project. And we do that a lot at MOSTA. We have that in bigger question, and we do kind of a baseline assessment. And then the next phase would be an intervention. So you would build on that PICO as you go along. Did that answer your question?
Yes, thank you. Made notes.
Anybody else have any thoughts? Well, we've recorded this, and the nice thing about it is that I'm a big fan of chunking information and then having it available in asynchronous learning. So I'm hoping that the Research Institute, possibly with the TLC, will archive these and then have them available for folks as they have need. And again, this is more of a conceptual framework as opposed to step 1, step 2, step 3, step 4. I think the reflective process in research is way underrated, and we end up zooming out and no pun intended. We go forward without really pondering the ins and outs. And so this is kind of like the very, very, very front end to help people in their process. And I think they'll be a lot happier with the outcomes because they've done the due diligence to get the groundwork done, a good foundation. So I guess with that, again, to respect your time, thank you so much. And I hope that this has been helpful. And please, please, please feel free to contact me or your mentors or research support. You have a great many people who are here to help you. And I just wish you all the best and be well. Thank you so much. Bye-bye.